The solutions are right here. We just need to put them into action. Let's hear from youth around the world as they share their own HIV prevention campaigns. Learn about global HIV challenges and our PrEP the Future initiative. Prepare to be captivated as they reveal their innovative strategies, the impact they've made, and the secrets behind their success. This isn't just an event. It's an interactive experience where you can ask challenging questions, engage in discussions, and find your own spark for change. The solutions are right.
Hello.
And I'm also a postdoctoral research fellow at York University, where I focus my work on communication and public health. And that's why, for me, it's a fantastic opportunity to be here with you guys, talking about PrEP, talking about HIV prevention, and talking about new strategies that we can have to address the HIV infection globally. So sharing the stage with me, I have David Ita. He's a community HIV prevention advocate from Nigeria. So thank you so much for being here, David. We have Siku Lajwako, a sexual and reproductive health and rights advocate lead from Eswatini. How are you? Siku?
Do I'm audible?
Okay, we also have Abia Karamat, an HIV and PrEP activist from Pakistan. How are you, Abia?
Hello, everyone. First of all, thank you so much for having me on this platform. I live in the downtown of my city, so please excuse the traffic noise. I'm back.
Thank you so much for being here. And we also have a special guest, Rohail Nawaz, a pharmacist from the PrEP clinic here from Toronto. So thank you so much, Rohail, for being here with us today. So in this panel, we'll hear from youth worldwide sharing the results of their own HIV prevention campaigns that were organized through our PrEP the Future initiative and learn about global HIV challenges. But if you're wondering what PrEP the Future is a new initiative by Let's Stop AIDS. It is a youth HIV leadership boot camp. Isn't that amazing? We have a boot camp to teach advocacy skills and help young leaders to know how to implement advocacy campaigns. And this initiative was made possible thanks to the support of Vive Healthcare. So thank you, Matthew. Matthew is here somewhere. So thank you so much for your support there. Thank you so much. And the goal was to train young leaders from around the world with advocacy skills, as I said, to help them organize their campaigns. And guess what? Abia, Siku, and David are the participants of this initiative. So thank you so much.
You're welcome.
With them, we also had other 3,000 applicants, and we had to select only 40. So you were the lucky ones. And I hope that you had a great experience with the program.
Sure.
So, Abia, let's start with you. I want to listen like about your campaign and your expertise. What were the challenges that you tried to face and how you developed your campaign? You're muted. uh, Abia, I think you're muted. Thank
Sorry, do I'm audible?
you so much.
Okay, so sorry. Okay, let's start. So I stand before you today as a passionate advocate for public health, driven by a deep desire to make a positive impact on the lives of marginalized communities in Pakistan. My journey is in the field of public health education has been one of dedication and unwavering commitment. And today I'm here to share my experiences, my campaign, and the invaluable support I have received from Prep the Future campaign. From the very beginning, I have been a mission to address one of Pakistan's um, most pressing yet often neglected health issue, HIV prevention. Discussing sexual health is considered a taboo in our country, so leading to that neglect of problem that has been silently growing for so far long. So in 2019, the devastating outbreak of HIV in Hyderabad, Sindh, left many lives in shambles due to the lack of HIV prevention medicines. The government in action, the face of this crisis left me filled with sorrow, prompting me to take an action. I started my journey with volunteering with the Youth Advocacy Network, Institutes of Social Youth and Development, Gender Guardian, where I work closely with transgender individuals and men who have sex with men. But the turning point of my journey has been changed when I participate in Prep the Future program. This opportunity has allowed me to deepen my understanding of HIV prevention, and I equipped me with crucial knowledge and skills. So I conducted Prep the Future campaign at Kinnaird College for Women in Lahore, Pakistan. My primary agenda was to raise awareness and promote the adoption of Prep to reduce stigma associated with HIV and sexual health. The response I received was noticing the short of inspiring students from different backgrounds and various interests joined in. They wanted to know more and had questions. They talked about HIV and why PrEP is important. The session were not just about giving me and giving out the facts, but they were about helping everyone understand HIV and PrEP better. Student got involved. The open conversation helped them to understand more and feel more in control of their sexual health. The campaign demonstrates the impact of informed and empowered individuals coming together to create a change. Um, these girls armed with knowledge and compassion and our mission to take a real impact. They are distributing these girls uh, distributing essential resources like condoms and educational material to vulnerable communities. It is a testament to what we can achieve when we break the silence and transform our communities. I want to extend my heartily thank you to Prep the Future team to give me opportunity to connect with and collaborate with other passionate individuals from diverse backgrounds. Engaging with like-minded peers provide fresh perspective and invaluable learning experience. I firmly believe the forming valuable partnership during this program has been amplify the impact of initiative. Thank you, Prep, for being a part of my remarkable journey. Together, we are the change that we want to see in the world. Thank you.
Thank you so much. I think your work has been like amazing. And I can see that we have a very young audience here. Do everyone know what PrEP means? So that's the question that I'm going to ask you, Roheo. Maybe you can explain to us what is PrEP and why it's so important before I pass the word to David.
Yeah, sure.
Do you have a microphone? Can you borrow yours?
All right. So PrEP basically stands for pre-exposure prophylaxis for HIV prevention. It's a medication that you can take every day to prevent getting HIV, basically. And that's pretty much it.
And is that efficient?
Yeah, so it's up to 99% effective if you take it every day.
So that means that we have a drug that you can take before, so you can plan in advance, like even if you don't wear a condom, you can still take the medicine and then you'll not be infected, right?
Yeah, exactly. So you have to take it for at least 7 days before any sexual encounters to get up to the full 99% protection rate, because it takes a bit of time for it to build up in your body. But then, yeah, you'd be at the 99% protection. You can have sex, you'd still be 99% protected even without the condom. Again, it's only for HIV prevention, doesn't prevent anything else. But yeah, so after the 7 days, you do have to keep taking it to maintain that protection, though.
Amazing. So I guess that's why it's so important, right? Because it's a new strategy that we have available.
Yeah, exactly. It's just another option that people have to prevent HIV.
Amazing. So now it's with you, David. Share with us what was your campaign about and the issues that you tried to address.
Okay, good day, everyone. All protocols observed. My campaign was to introduce adolescent and young persons to PrEP and where they can get it free. And the objective was to reach out to people between the age of 15 to 29 and also to link them to One Stop Shop. One Stop Shop is a private clinic funded by partners and is a youth and a community-friendly clinic where there is no discrimination or stigma, irrespective of your sexual orientation. So because of the stigma people faces from public healthcare centers, so that's why most funders like the Global Fund, the PEPFAR, and the rest, they fund those clinic in some specific organizations where LGBTQ persons can go there and access PrEP and PEP free. So the rationale for this my project is because of the adolescents in Nigeria is estimated to be 3.5, the highest among West Africa's countries. And that's the prevalence rates for adolescent and young persons. So like UNICEF in 2017 talked about 230,000 persons between the age of 10 to 19 we are living with HIV, and 5,400 have succumbed to death, HIV death-related issues. So that's why I choose that age group. And I implemented my project in 4 states in Nigeria: Cross River, Akwa Ibom, Lagos, and Ekiti states, because of the prevalence rates in those areas. Although one of the highest prevalence states was Benue, being the highest, followed by River State, but I choose those ones because I had a volunteers that I trained 2019 during my campaign with the Global Advocacy for HIV Prevention, because I am an alumni for that organization and it's based in New York. So that was why. Then I recruited 7 volunteers. 2 worked mainly online. Then I had 1 data collector that was working in the field using Kobo Collect 2. I don't know, some of you might know Kobo Collect 2, where as they are doing the interview directly, we are getting the data from the field so that some people will not doctor data. So that was his own job as the MIE. Then others worked physically with mainly females and female physically. And we were able to reach about 1,400 from the online engagement, direct engagement, and physically 200 persons, face-to-face meetings, it's about 200 persons. And we are having meetings constantly on WhatsApp. And during our campaign, we reached more persons on Twitter among the social media campaign, followed by Facebook and WhatsApp and the rest. So we noticed that during our physical campaign, women we are more acceptable the acceptability for PrEP were more female than male. We were able to reach about 83.4% for female, then 16.6 for male.
Yeah.
Then the level of awareness too, female had more awareness for PrEP than male.
Oh, really?
Yeah. Then that said they had awareness, we had about 53% that had the awareness for PrEP. Then 46% had no awareness for PrEP. Then we also noticed that the level of awareness by age, the people between the age of 20 to 24 had more awareness of PrEP than people between the age of 15, 19, and 25 to 29. Then people between the age of 30 were like less than 10% that had the awareness for PrEP. So we noticed that this age brackets of 20 to 24 had more awareness for PrEP from our data collection from the field. Then, like I said before, the Twitter, LinkedIn, and all the rest, the percentage, Twitter was higher.
It's interesting that you
So
that you
that's
had
all that we
data,
had.
right?
So thank you.
Thank you so much for your data collection, and it's incredible that you have data and you have like ways to measure the impact of your campaign.
Yeah, sure.
Right. Thank you so much for sharing with us. And Siku, could you share with us also your campaign? Siku is from Eswatini. Siku? Okay, while Siku cannot connect with us, I'm going to ask you, Rohel, is there any similarities between what David brought with what we see happening in Canada in terms of awareness, in terms of information about PrEP and adherence?
Yeah, so there definitely is. One amendment I do want to make about my earlier statement about how PrEP works. So the amount of time it takes to reach the 99% depends on the type of sexual activity someone is having. If it's like oral sex or receptive anal sex, it takes 7 days. If it's vaginal sex, it does take 21 days, just because it takes longer for the medication to localize in that part of the body. So just wanted to clarify that first of all. But yeah, in terms of adherence and things, there are some issues even in Canada, because like you can think it from anyone's perspective, taking a medication every day, it sounds simple when someone tells you to do it, but when you actually put it into practice, it's hard to consistently remember to take something every day. Like even like multivitamins, something people should take every day, it's like you'll forget about them occasionally. So like PrEP does give a bit of leniency after that first 7 days. If you miss a pill here or there, your protection's not all going to go away at once. You have to miss like consecutive days or multiple in a week for it to really drop. But yeah, that is something that I've seen with people I've talked to, just trying to figure out ways to improve their adherence. So it's like setting alarm clocks on your phone, stuff like that, just to help you remind to take it on time.
Yeah. And we probably can like spend a few times after Siku talking about other possibilities. I think like we could talk about injectables that could like solve that problem, right?
Yeah, so do you want to talk about that now?
Just let's see if Siku is with us. Are you there? It's interesting about this online thing that we are talking with someone somewhere. It's like how it's good, but also it's a challenge. But yeah, go ahead.
Yeah, so injectable PrEP is not a thing in Canada as of yet. It was approved recently in the United States. Basically, the injectable PrEP medication is called cabotegravir. It's something that's used like an injection given once every 2 months. There's different ways to start the medication. Some people, depends on the prescriber's comfortability, really. Some prescribers would want you to do like a 1 month lead-in period of oral medication just to see how someone reacts to it. Then you take the injection, then the second injection is 1 month after the first one, and then after that, it's every 2 months. So it is a bit more convenient that way. You don't have to take something every day. Downsides are people don't like needles. So there's like give and take there.
Yeah. Yeah, I think it's a great advance to provide the two possibilities for everyone, right? I hate needles, for example.
Yeah, no, that's fair. It at least gives people different options instead of just having the one thing.
So let's see if now we have Siku. Are you there, Siku? Is Abia there? So probably you have an issue with the connections. So David, you were talking about awareness about PrEP in your country. How is access to PrEP there? Is it easy? Is there any sort of stigma associated with it?
Yeah, like I said before, for the public healthcare centers, we have the central hospital, we have the tertiary institutions, that's the ones linked to universities. We have the one for states, then we have the primary healthcare centers. So accessing it through those means is not that easy, but PEP is easier because healthcare professionals, they are prone to have a needle prick, which they need to take post-exposure prophylaxis. So to find PEP is easy, but to find PrEP is not that easy. And most pharmaceutical shops don't sell PrEP. And if you can even get it from some places, it's expensive. Even ordinary HIV drugs is about $134 for somebody living positive, taking drugs from your own pocket. So you see, accessibility is that easy, but is also easy. Why I'm saying is easy because it's mainly for key populations. Because funders concentrate mainly on key populations, which is a challenge also. So the awareness is only circulating around key population. When I say key population, I mean the gay, the female sex workers, the transgenders, and lesbians and others. So they are the ones that access it easily because they are already in the network to access it from those private clinics. But the general populations don't have the awareness mainly that they also can access it from those places. It's just for them to know your sexual activities, if you are sexually active, and the rest, if you are HIV negative and all the tests they run for you is okay, then you access it, but they don't know that. So that is why I said it's easy. It's also easy.
I got it. Yeah, it's and you touched on a very important topic that is affordability, right? Yeah, and I guess in Canada we have a few programs to guarantee that PrEP is affordable, right, David?
Yeah, so in
Sorry.
general, PrEP is
Raheel.
quite expensive. So like one bottle of PrEP is roughly directly out of pocket. So there are certain programs. It really depends on the province, at least in Canada. Certain provinces it's completely free under the government, such as BC. The Ontario government, it's not free for everyone. Like you have, it's free for people under 25 or 65 and up because they're part of the government program for drug coverage. For everyone in between, they're not technically covered. You can apply for a drug coverage plan with the government, but it's more based on how much money someone makes. So it's a cost sharing program where depending on how much you make, the government will pay after you pay a certain amount. So it will be free eventually, but it really depends on how much you make.
Thank you so much. And I think this is when we are talking about young people having access to these strategies, as I said, affordability is key, information is key, awareness is key. So if you have programs and if anyone here wants to have access to any of these medications, I think the PrEP clinic has information on your website too, right?
Yeah, exactly. You can visit our website, prepclinic.ca. We have all that information, and we also do help with affordability for people who are between those ages where the government doesn't cover. So it's usually $250 a month. If someone has no coverage, the most we would charge them is $110. So you save $140 a month. And yeah, we just try to do as much savings as we can.
Great. Siku, are you there with us?
Yes, I'm here.
I can see something moving. No?
I want to also ask, do you have people have that ring for female? PV ring.
Sorry,
The
the
PV ring.
ring? No,
Yeah, you
we
have-
don't have that.
Okay.
Okay, so I think one last question that I want to ask you, David, is how was the experience of participating on this program that Let's Stop AIDS and VIV organized? Like I know that you were intensively participating on the sessions, and then there was like a mentoring period of time that you were involved with our team. How was that experience? And do you think that is interesting for anyone here to participate?
Yeah, sure. Even with my years of experience, I learned some new things from the campaign because learning is a continuous process. So um, there are some also skills for advocacy and project implementation I learned from the program, which will also help me and which I've also used for my volunteers. I did step-down training and I also shared some materials with them, including the simplified and prep messaging I shared because it helped them to use that for those that don't know much about scientific things because there are some persons where you tell them prep. Imagine you telling somebody that didn't go to school prep.
Hmm.
Person will like, what are you talking about? But when you put it in a simple language that this is a drug that you can take that will prevent you from HIV, that is what the person wants to hear. So I did things like that to make sure they know and how it works and all the rest. So the program helped seriously because shared my knowledge with my team and all they asked me to do, like for example, this data collection stuff, if not for some of those lectures you guys gave us, I would just tell them to work, not track it to the very list of uh, persons we met on the field. So it was helpful and it's encouraging for others to join for the coming cohorts.
Let's see if we're going to have a second edition of Prep the Future in the future. Okay, so I guess we still are having like technical issues. So thank you so much, Rohel, for your participation. Thank you so much, David. Thank you so
You're welcome.
much for Abia. And I'm so sorry, Siku, for the connection. But I'm pretty sure that the campaigns that you organize in your countries will move the needle. And this is just a spark